as students are home during this time of pandemic. And we are incredibly fortunate tonight to have Dr. Ann Helmus, who is a pediatric neuropsychologist. Probably a lot of you are familiar with her and her work. She's the director of NESCA, multi-disciplinary group practice. And NESCA is an organization that for many years has really worked in close partnership with MAC, providing tremendous guidance and resource and expertise in terms of how to best address the needs of students with all types of disabilities and complex disabilities. And she and NESCA have been at the forefront of trying to figure out how to evaluate and reevaluate students in this time of COVID in a way that is consistent with all the safety and health requirements. And so we're really fortunate that she's here tonight. A couple logistics before we get started. I'm joined today by David Spicer and Joanne Pino from MAC, who will be helping to handle all the logistics. If you have questions, please include them in the chat bar on the bottom. And David will be reading the questions. We'll stop once in the middle and then have more time for questions at the end. This will be recorded. We'll end at 8:45, and for those, if we haven't answered all the questions, Anne is willing to stay until 9 for anybody who wants to stay longer. So any other logistics, David or Joanne, that I've forgotten?
I think so. I don't think
I think
so.
that covers it.
Great. Well, I'm thrilled to turn it over to Anne.
Great.
Thanks for being here.
Thank you so much, Julia. NESCA, of course, is a huge fan of MAC, and we're really happy to be collaborating with you this evening. So I'm going to talk a little bit about what our journey has been like over the last 12 weeks, thinking about how to evaluate kids. And so for us, I think it was around March 15th where it became clear that the world as we knew it was changing. And sorry, get rid of this poll. And so I told everybody in my office, try and get all the kids in to finish up the testing this week, because on March 19th, we're closing the doors. And of course, at that time, I thought we were going to close the doors maybe for a month and that school would be back in session maybe by April 10th or something like that. And, yeah, I think, or maybe early May, but obviously things didn't turn out that way. So as we sort of entered this unprecedented time, we worked together as a team to sort of think about, well, what are we going to do? How are we going to respond to this pandemic? And so I've listed here what the options were that we came up with. And I'm going to go through each of these options and what the pros and cons of them are. So the first option was just suspend all testing, don't do anything. And that seemed like a reasonable option if the pandemic was just going to be for 4 weeks of a lockdown. But as it became clear that it was going to go longer and longer, that wasn't really a good option. Another option that we spent a lot of time studying and looking into is teletherapy, which basically means that you would use a format like the one we're using tonight on Zoom and administer the tests through the computer with the child at home and the neuropsychologist or the psychologist also at home. The third thing that we looked at was the use of a Plexiglass Shield. And so the idea there would be that the child would come into the office and the evaluator would come into the office and you would just have a big shield between them. And I'll show you that. Another option that we looked at was social distancing. Again, the child and the evaluator would come into the office, but they would maintain 6 feet of distance and both be wearing masks. And none of those options seemed perfect to us. And so what we came up with was this 2-office plexiglass model, which I will present here, but I want to first kind of go through these other options, which we're using bits and pieces of. So in thinking about what we were going to do, the name of the game here was how to balance safety and validity. And so by safety, clearly what we meant is that we needed to minimize contact between the evaluator and the child because we didn't want anybody to get sick. But we wanted to have the test be valid. And so what validity means is, you know, to what extent are we measuring what we think we're measuring? So for example, if we're trying to measure attention in a child and we're trying to tell them a series of numbers that they have to tell back to us, and we're doing it over the computer and the computer platform is unstable and it's hard to hear and that kind of thing, and so the child does poorly, we don't really have a valid measure of attention, right? Because the computer glitch got in the way of what we were trying to measure. Or if we're doing testing and let's say a child has a seizure in the middle of a reading test, those results aren't going to be a valid measure of how the child reads because something interfered with their ability to perform on the test. And one of the things that's important to understand about psychological testing and educational testing is that it's not like a blood test. And what I mean by that is that if you go to the hospital and you have a blood test, it doesn't matter if you like the phlebotomist or you don't like the phlebotomist. It doesn't matter if it's hot in the room or it's not hot in the room. It doesn't matter if you're in a good mood or a bad mood. Your blood work is going to look the same regardless of all of those variables. That is not true for standardized testing. So when we're talking about testing a child, any type of psychological testing, educational testing, there are all kinds of variables that will determine how the child performs. And so there's environmental variables. So if they're in a very noisy place, if the temperature's not right, things like that, it may distract the child and so they're not going to perform to their highest level. Qualities of the evaluator can make an enormous difference on how a child performs. So if you have an evaluator that's anxious during the testing, chances are they're going to make the child anxious and the child may not perform to the best of their ability. Or I see often when we have, postdoctoral fellows, people who aren't that familiar with doing the testing, it impacts the testing results because they're not completely confident in their administration or what they're doing. There are a lot of children that come in that need somebody to motivate them to do the best that they can do. And so again, if you have an evaluator that can make a good relationship with a child and really motivate a child to do well, you're obviously going to get higher test results than if you have an evaluator who's sitting there who's just going through the questions and doesn't spend a lot of extra time and energy trying to motivate the child. So there's many, many factors that go into the validity of testing. And I think one of the things that's really important to point out, because this is the big debate. So for example, school systems are saying, we may not accept testing that's done by the computer because we don't think it's valid. And one of the things that I've been trying to point out to schools and people who I'm talking to this about is that good evaluators always have to judge the validity of their test results. And so even if you're doing testing by computer, you need to judge, did anything that happened on the computer impact the validity of the results? And so that could be anything from an unstable platform that was freezing all the time, or the fact that, well, I was testing this child at home, the dog came running in and leaped on the kid and distracted them. So, it's part of the evaluator's job to determine, no matter how you're testing a child, if there are things happening in the environment, in the relationship with the evaluator or in the child themselves that would impact the validity of the test results. And this new situation of COVID testing, it just introduces a whole new set of variables that we need to judge. So how do we judge the validity of test results? Well, one of the things that we do is that we look and we say, do these test results make sense in terms of other tests that have been given if a child has already had previous testing? And so that's a reliability measure. Another way that we assess the validity of test results is that we look for other sources of information. So for example, if I gave a reading test and a child did poorly on a reading test, one of the things I would want to do is to find out, do the parents think the child has trouble reading? Does the teacher think the child has trouble reading? Did the child pass the MCAS? Has school done testing in the area of reading? And let's say all of those data points turned out to be, yes, everybody's concerned about reading. I'm going to trust that this is a valid and reliable test result. If I look to all of those sources and the mother says, no, she spends all of her time reading Harry Potter, and the teacher says, no, I've never seen a problem with reading, then I'm going to think, okay, this is not a valid measure of reading. Maybe the child was distracted, unmotivated, made a mistake on the bubble sheet, who knows? But we never just want to take a test result in and of itself and say, this score tells us that this child can't do whatever the test is measuring. We always want to look at that test score in the broader context. And so the broader context that we're looking at is history. And so again, if we go back to a score on a reading test, I would want to look at the family history. Is there a family history of dyslexia? If there is, that might lead me to believe that this was a correct test score. We would want to look at developmental history. Did this child have language problems growing up? Was this child slow to learn the letters when they were in preschool? those kinds of historical pieces of information would sort of buttress my feeling that this is a reliable test result that this child is having trouble with reading. Similarly, as I was mentioning before, we want to get observations. And so we want to get observations from parents. Do you think the child has trouble reading? Oh, you observe they read Harry Potter. That's an important observation. What does the teacher think? And what do I observe? So if a child did poorly on a silent reading test, the next thing I'm going to do is give them an oral reading test so that I can observe them reading and see if what I observe fits with their score on the silent test. And then finally, not only in testing, not only are we looking at the scores that a child achieves, so we're looking to see if you're a third grader, are you performing at the level of most third graders? But we also want to look at how they achieved those scores. And so the example that I got in graduate school that just always stays with me is that there's a test where we give kids 9 blocks or little cubes, and we ask them to make a pattern that we show them with the cubes. And if you have a child with ADHD who gets 8 of the cubes correct and then sort of loses interest in the whole thing, and the 9th cube is incorrect, they get 0 points for what they've done. If you have a child who looks at the blocks and picks them up and flings them at you or eats them, they also get 0 points. And these are obviously 2 really different kids. And, so the child who can get 8 out of 9 blocks correct and makes careless errors is really different than the child who attempts to eat the blocks. And the meaning of their scores will be very different. So again, one of the really important things to emphasize here with testing is that we don't do tests just to get scores. We have to think about what those scores mean. We have to think about if they're valid, if they make sense. And that's just the job of a good evaluator. And it's now being made more complicated by the demands of COVID, but it's not impossible to do. So face-to-face testing, which is what we used to do in the old days before we were overrun with viruses, is the most valid way to test kids because those are the conditions under which the tests were normed. And the evaluator can manage environmental variables and support the functioning of the child most easily. So if there's a child who is not paying attention, it's very easy to sort of cue the child back to task if you're sitting across the table from them. And so from a validity standpoint, face-to-face testing would be the way to go. From a safety standpoint, it's the least safe option at this time. And, we really can't have, the tables that we have are 2.5 feet wide. And so I really can't have an evaluator sitting 2.5 feet away from a child for 2.5 hours breathing on them and vice versa. And, it's been made very clear by malpractice insurance companies, professional organizations, the CDC, everywhere you look, this is not an option. That being said, there are some places that are doing this. My advice to you as parents would be to not do this. It's not worth risking the validity for the safety here. And from everything that I've been reading, it seems like the most likely way that the virus would be transmitted is through prolonged face-to-face contact with somebody. And testing takes 2.5 hours. Where you would be, like I said, 2.5 to 3 feet away from each other. So I would not endorse this. So, as I mentioned, we thought about suspending all testing, and that's really not an option given how long this lockdown situation is going to go on. At this time, schools are still required to carry out mandated testing, so they're going to have to figure out what they're going to do about that. But I think even more that we really have an ethical obligation to identify children who are in need of services so that they can have intervention in a timely manner. And so, yes, there are risks inherent in doing testing. There's risks inherent in leaving your house, but there are also risks inherent in having a child who has some kind of underlying disability that's not getting diagnosed and not getting help. And what we know is that early intervention is the way to go, and that the sooner that we're able to identify problems and that the sooner we're able to address them, the better the outcome will be because of what's called neuroplasticity, that the brain is more easily able to change when children are younger than when they're older. So to me, it would be unethical to say, we're just going to wait for a year until this thing clears up because we want everybody to be safe and we're not going to do this testing. So telepsychology, as I mentioned, would be using a platform like the one we're on tonight to administer tests. And there's a number of issues with this. The first being technical. So any of you who have now had to spend time in education or in your workplace being on Zoom all day or any of these platforms, I think you probably share my frustration that they freeze, that it's hard to see people, that to me it's exhausting to be on these all day. There are a number of sort of ethical issues that are associated with telepsychology that basically have to do with the validity of the testing. And the idea here is that when a child is given a test, we compare their score against the normative data that comes with the test. And that normative data was generated on face-to-face administration, not on computer-based administration. And the research has not been done to say whether it matters or it doesn't matter. On the surface, I think we would say, how could it matter? Why would it make any difference? And that could be true, but we don't know if it's true. And so it's leading a lot of schools, I think, understandably, to question, are the results the same and can we trust them? Another ethical issue is that as psychologists, we're not allowed to release standardized tests to the public. And so if these tests are being shown on screens, people are taking screenshots, things like that, we're losing control over the test materials, which shouldn't happen. And then there's potentially some legal issues like copyright laws when we're copying papers and sending them to kids and things like that. And then also, I think this hasn't been tested yet, but if testing is done through this type of a platform, will the results be seen as credible in a hearing situation in front of BSEA? Are they going to be seen as credible in a team meeting? And we were worried about a situation in which we would have a child go through a whole computer-based testing assessment, have the school reject those findings, and then have the family feel like, why did we do all of that? Why did we pay for that? Why did we spend all the time doing that when the school isn't even going to look at it, or they don't think it's credible? And now some of the tests, like the IQ test, have just been administered. We're going to have to wait a whole nother year before that test could be re-administered. And so we were concerned about getting into difficult situations with families and schools using computer-based testing. There's a number of technical considerations with computer-based testing. The client and the evaluator obviously both have to have computers. I think it's possible for the child to have like an iPad, but you have to have decent technology. You have to have strong Wi-Fi in both settings. And my understanding is that an Ethernet cable is even better. And a big one is that the evaluator and the client both have to be proficient using Zoom, using DoxyMe, whatever they're using. And, I think one of the things that's difficult, like with some of the evaluators in my office, they're really not too tech savvy. They don't feel very comfortable on the computer. And I think that would be transmitted to the kids that they're working with. You need to have a HIPAA compliant platform for testing, which is essentially Zoom or DoxyMe. And so right now, a lot of the tests are available at no charge through Pearson, but that's ending in July. And so as of August, there's going to be a lot of costs associated with this because all these, Pearson got everybody addicted now to this. And so now they're all going to have to start buying these tests. And David, maybe after this slide, we'll stop for a minute and take questions. So what are some of the issues with the computer-based testing that could impact the validity? Well, one of them is a quiet, distraction-free environment. And so I had an evaluator here who, at the insistence of the parent, wanted to try computer-based testing. And the evaluator said it was unbelievable, the number of times that siblings were running through the room, the dog was running through the room, the mother was talking on the phone, just incredibly noisy, sort of busy home environment. And we wouldn't consider that to be a very good testing environment. You have to be comfortable with the technology, with online test administration. It's not something that you can just do the first time you try. You have to practice and be good at it. What Pearson, who is the biggest provider of these online tests, has said is that if the screen freezes during a test, the entire test is considered invalid and has to be thrown away, which then would mean the evaluator would have to pick another test that would test similar skills and try again. I think there's a possibility of cheating. It'd be very easy for a child to have a calculator on their lap or, looking something up on their phone. Clearly, the quality of the human interaction, I think we've all seen that, you know, a Zoom party or a Zoom get-together is nothing like a real life get-together, and that we don't relate to each other at all on the same level through the computer that we do face-to-face. And that when the evaluator is sitting at home and the child is sitting at home, it's extremely difficult for the evaluator to provide any sort of real support for a child who's not paying attention, or a child who's becoming frustrated and emotional, or a child who's acting up behaviorally. And that type of support is a regular part of our job when we're working with kids, is to, you know, make sure that we're getting the best test performance out of them by making sure that they're feeling comfortable, that they're paying attention. When they start getting frustrated, to sort of back off, knowing when to take a break, all of those kinds of things, which are obviously much easier to do when you're face-to-face with a child than when you're on the screen with them. David, are there questions now, or should I keep going?
Yeah, I have a few questions, and definitely all our participants are free to leave questions in our chat. So I'll just start off with a few questions.
Sure.
So what is the best way to approach a clinician or teacher and ask for an observation? What sort of information should a parent provide, and what might that ask look like?
An observation of the child in the classroom? Is that what you mean?
Correct. Yes, I think that's what the parent meant.
Or an observation during COVID. You know, how would you do an observation if the classrooms aren't open?
I mean, right now, I don't think you can.
I mean, can you observe remote instruction? I mean, I guess that's the question, is how would you do observations right now while schools are doing remote learning? Or how would you suggest?
It's hard for me to imagine how you would do that. I mean, my understanding from friends who are teachers is that they're on a screen and there's 24 little, you know, little faces on the screen. And I mean, I suppose that you could join that Zoom call. You know, I don't know what the confidentiality issues are with that, but I'm just not sure how much you're going to actually see. So I think the answer to the question is that it's virtually impossible, I think, to do observations right now of what a child looks like in the classroom. I think it's even hard for teachers to do it.
Perfect. Another question, I think this has been on the mind of a lot of our participants. So in the case that we do, let's say, have a second wave of COVID, or maybe the district is really backed up and conducting evaluations, and those reevaluations are necessary to get special ed services. Is it better to get the tele-assessment, at least for part of the evaluation, that can be conducted through teletherapy?
Better than what? Better than doing nothing?
I think that means doing nothing, yeah. If they can't do the kind of assessment that you're doing in your office.
Yep. So I think, and I'm going to get to that a little bit later, but yes, I think that if, particularly for an initial eval, if it's a diagnostic evaluation, and the reason why I say that, and it's giving away one of my later slides, but that's okay, we'll talk about it now and skip over it later, is that if I'm making a diagnosis, let's say I have autism, my diagnosis is not just based on any test scores. It's, you know, if anything, I'm sort of using the test as a way to be able to observe the child in a structured setting and see how they respond to testing stimuli and that kind of thing. And so my diagnosis of autism is going to be based on the history of the child's development, observations that I have of how the child interacts, observations that the parents share with me of what the child is like with peers and with teachers, what the teacher's observations are, and the testing data. But the testing data is just one leg of the triangle, or one leg of the stool. And so I think if you can put everything together, then yes, I think that's definitely better than doing nothing, because doing nothing means the child's not getting identified, not getting services. If you're saying to me, we're talking about a follow-up evaluation to see if the child is making progress, that's where I have more difficulty with telepsychology, because in that case, a lot of times we are putting more emphasis on the testing scores, right? If we're taking a child who has a reading disability and we've done all this intervention, and 2 years later we want to see, is their reading improving, or how much is it improving, then we're probably looking at testing scores more than anything else. And that's where I would wonder about, you know, are they completely valid being done with telepsychology? But definitely for an initial eval, telepsychology would be far better than nothing. Should I keep going or?
Awesome, awesome. Yeah, I think that's all the questions we have, I
Great.
think, coming in, but definitely encourage more questions.
Perfect. So I probably stopped this one slide too soon. So sort of other considerations about the computer-based testing is that you can't easily observe the child's process on many tests. So one of the things that I'm doing when I'm evaluating a child is I'm watching them like a hawk all the time. You know, how are they going about doing this? Are they really fast and sloppy in their work? Are they going slowly? Do they get distracted and look out the window? Do they try the same thing over and over with a puzzle, even though they know it doesn't work? I'm constantly watching what their process is. And again, if we were just across from each other the way we are right now, it's really hard to see what's happening on the table. Now, it is possible, you know, some people who are getting really proficient with this computer-based testing are recommending a 2-camera model where there's actually like a webcam that would be going down into the child's workspace. Or sometimes they say you can tilt the computer screen so that you can see what they're doing. You know, I think all of those things might help, but it's not the same as being able to take in the gestalt of the situation, seeing the child's face, seeing what they're doing, you know, all of their work. And so you have reduced quality of behavioral observations. And then there are some of the tests where you would have to mail tests back and forth. So if the child writes an essay, you have to ask the child to take a picture of the essay in front of you so that you have a screenshot of it. And then they have an envelope that they put it in, they send it to you. You know, if you want to do block design, you have to send them the blocks. You have to hope they send the blocks back. So there are a lot of aspects of it that feel fairly cumbersome, kind of a lot of organizational details for parents and for the evaluator's office. You know, I think the benefits of doing the computer-based testing, or the times when it would make sense, if you have a client, I mean, I have some kids that I've seen 3, 4, 5 times. So if I already have a good relationship with a client, probably an older kid, I think that it could probably work a little bit better. And as we were just talking about now, you know, when the test results aren't the key determinant, where you're going to definitely be taking a really good history and observations and having a lot of data that help you reach the conclusion that this child has learning disability or has autism or intellectual disability, whatever it is, emotional issue. You know, another benefit of the telepsychology, of course, is that it decreases the amount of time in the office, so that it increases the safety. And you just always have to think about this as a cost-benefit analysis. You know, exactly what you were saying, you know, if a child really needs testing for a diagnosis, the cost of not doing that is really high, and the benefit of doing it is strong. So right now, in general at NESCA, we are using Teletherapy for the parent intake. And so the parents have filled out all the questionnaires, and then we set up a Zoom meeting with them to do our intake, which we used to do in the office. Same thing with the feedback session, which happens after we've done all the testing, and we want to provide parents with the results and recommendations. And sometimes doing some brief testing if there are tests that really would be easy to do because they're primarily verbal or something like that, we would do that type of brief testing. And I'm not sure if it's in another slide, but another time that we've used teletherapy has been before we had our current model set up, which I'll show you in a minute, for kids who were in sort of psychiatric crisis, and that we really needed to sort of do a quick evaluation to help parents determine whether the child needed some kind of extra help. I think using the teletherapy for progress monitoring is problematic because of the validity and the reliability issues. And you're comparing, if you're doing it through teletherapy, you're comparing results done through teletherapy with results that were not done by teletherapy. And I think that could be problematic, and also that you're not getting as good behavioral observations. So if I was making the policy in the schools, I would say to them, if you're going to use teletherapy, focus on all the initial evals first, and then think about the, think about the progress, follow-up evaluations through your evals. So we are having kids come into the office, and I'll show you the setup that we're using. And we're trying to follow all of the CDC guidelines, or we are following all the CDC guidelines. And so both clinicians and clients complete questionnaires that help us to assess their risk of exposure. And excuse me, everybody who comes in gets their temperature taken every day, and hand sanitizing. We have this sort of touchless check-in process where everything is kind of laid out for them, and we have an administrator in a separate office with a cell phone, and the cell phone number is there for the parents to call if they're having any trouble managing things. We only have 8 people in our office suite at any one time. Parents are in a private waiting room, which is a former office, and the equipment in the rooms are being sanitized before and after every appointment. So we're really trying to make the office environment as safe as possible, and actually should say on here, everybody has to wear masks when they're walking around the office. So the social distancing model, like I mentioned, would be where, for example, we have a big conference room. You would be in the conference room, you're wearing a mask, the child is wearing a mask, as I said, I don't think that it provides maximum risk reduction, but, it might seem sort of more natural because there's no barrier between the child and the evaluator. The evaluator would set up all of the testing materials ahead of time. So normally if we're testing a child, we are, putting things across the table here, do this, do that. When you do the testing through social distancing, everything goes in different colored folders and they're put in a pile in the order that we're using it. And so then you say to the child or the child's parent, if they're helping, okay, please take the blue folder and take the page out. You'll see at the top, there's this is what I need you to do, and so on. We have a lot of the tests right now are on the iPad. And so instead of using paper, kids are just holding an iPad and they see the test stimuli in front of them. And with the social distancing, the evaluator and the child are always 6 feet away from each other and everybody is wearing masks. I think that the wearing masks to me is problematic. I think most people for 2.5 hours wearing a mask, it becomes uncomfortable, it becomes distracting. It's hard sometimes to hear clearly for people. And again, a big part of what we do are behavioral observations, and the entirety of the face gives us really important information about how people are feeling and, perhaps what they're thinking, and gives really important cues. And so to have half the face covered up with a mask makes that much more difficult. What we have done for parents who want to do this social distancing model and for evaluators who are comfortable with it is that we have the evaluator and the child meet ahead of time via Zoom so that they can see each other without masks. And then the evaluator will say, okay, I'm going to put my mask on, so you're going to see what I will look like when you come to the office. You put your mask on. They, joke about the masks. And so they've sort of established that rapport without masks via Zoom. And then when they come in, everybody's in masks the whole time. So another possibility would be this type of a Plexiglass Shield type model. And so I don't think it's maximizing safety for the child and the evaluator. We have kids who accidentally or on purpose will knock over something like that. So we have this available for some kids. It's probably not the most preferred thing. So what's been most popular in my office has been this sort of 2-office model that we came up with. And basically what it is I had a contractor come in who cut a 4x8 hole in the wall and put in a big sheet of plexiglass. And so there's a large pane of plexiglass between 2 offices. And then we have desks pushed up against it, which, let me see, I think I have a picture here. Yeah, see, this is without the desk pushed up against it. So there's just a big pane of plexiglass. These are the 2 offices. And here it is with the desks pushed against it. And so the evaluator sits in one office, the child sits in the other office. You can see that there's a headphone there. And so the examiner has headphones, the child has headphones, which the kids are all saying, oh yeah, I use this all the time for gaming. They're very used to wearing headphones. And we administer the test the same way we would if we were sitting across the table from them. And the only thing that's different is that there's a sheet of plexiglass between us. And again, a lot of times, a lot of the evaluators like having the tests on the iPad, so the child's just accessing the stimulus on the iPad. which is controlled by the evaluator. I still do it the old-fashioned way with the stimulus books up against the plexiglass. Either way seems fine. And again, we have to organize everything ahead of time in folders because we can't hand the materials to the kids. So there's all different colored folders, and we just take the kids right through it. And most of the kids seem to sort of enjoy having that independence of, following the directions to find the orange folder and all that. We have only had so far, we've been doing this for about 3 or 4 weeks. We've only had one kid that needed to have his parent in the room. Several of the kids, we thought the parents would need to be in there, and the kids took great pride in kicking the parents out and saying that they could handle this on their own, and they did a good job. So yeah, so it's worked out very well. To me, this seems like it's the closest to what the standard assessment experience would be. And I think that's very important because it keeps the evaluator comfortable. They're doing what they've been trained to do. They're not learning a new technology or wearing a mask or things like that. It's closest to what would happen in the pre-COVID days when a child would come into the office. It's maximum risk reduction for the child, the parent, and the clinician, because the clinician and the child are always in completely separate rooms. They're not sharing the same airspace at all. And when, if the child comes out of the room to take a break, if the evaluator has to do anything, everybody's in a mask, staying 6 feet apart. I will say the one problem that sort of cropped up is that the headphones, some kids after a while get really tired of wearing the headphones and they say that they bother them. And so we bought a tabletop intercom system that doesn't have as high fidelity, so we don't use it a lot, but for some kids, just giving them a break from the headphones has been helpful. We've also discovered that if they just put their headphones around their neck, they can still hear perfectly, and so that is preferable for some kids. We can't provide physical cueing, so there's plenty of times when I was testing kids pre-COVID where a kid's getting squirmy or inattentive, and I would just put my hand on his arm or something like that to sort of gather his attention, or move in closer, things like that, and obviously that's not really possible with this model. And like I said, we've only had one parent in the room, which was actually very helpful for the child, but I could see for some kids that the parent in the room might be really distracting. And I think, there are some kids who really need to be tested by an evaluator who can interact physically with them. And so I'm thinking of a lot of our preschoolers.
There's the downside, and you froze. And you froze in a minute. You might want to repeat those last 2 sentences.
Sure. I was saying, I think, for some very young children or children on the autism spectrum, that this type of testing model is not going to work because you really need the evaluator to be able to have physical contact with them. And so in my office, the evaluators who see young children or see kids on the autism spectrum spend a lot of time on the floor, holding a child, guiding their hands, things like that. And those things are obviously impossible with any of these models. And so those. Yeah, and so I think, in thinking about what method you're going to use for testing kids, I think you have to think about what's the purpose of the testing at this time. And so, the 2 major types of evaluations that we see are either initial evaluations where we're trying to make a diagnosis, determine eligibility for an IEP. And as I mentioned, I think that in this case, the validity of the testing scores is not quite as critical because we have all kinds of other information. And so it may make sense in these situations to use the computer-based testing if that's what's most accessible. Like that's what most of the hospitals are using from what I understand. But I think for follow-up, I don't know if we can really monitor progress validly using any methodology of testing. And the reason why I say that is because I think there's so much going on for kids right now. Kids have been out of school to varying degrees. Kids are experiencing different kinds of emotional reactions to what's going on. I mean, there's so many variables that if we test a child right now and we find that that they do poorly on a test, I'm not sure that we can conclude that they've made no progress. because it, could be the case that they're just anxious, or they forgot how to do things because they haven't been in school in a long time or whatever. Are there other questions, David?
Yeah, we have a few we can ask.
Okay.
Yeah, so I guess one of the first one. So would insurance cover the teletherapy testing?
Yes. For right now, apparently the insurance companies are covering it during the state of emergency, and some of the local professional organizations are working very hard to lobby for them to continue to do so even after, if the state of emergency ends.
Perfect. Sounds like a great answer. So one of another parents, I'll just briefly explain the context. So you had mentioned that schools are required to carry out the mandated testing.
Yep.
One of our parents was on the wait list whenever school closures happened and was told testing won't resume into the fall. Mm-hmm. Can you specify what the schools need to do and the time frame by when the first testing is required to be done in this new COVID era?
Julia's going to answer that question for me.
I'll talk about the timelines, and Anne, I think, gave a variety of things of why schools could move forward, even in the time of COVID to conduct assessments. The federal and state government have been very clear, although everything's kind of sometimes clear as mud, that initial evaluations and reevaluations need to be going forward consistent with the regular timeline. So as this parent is, it sounds like for this parent's case, there was a referral for an initial evaluation, they signed the consent, and I don't know whether or not there would have been time to conduct the testing within the 30 days after the parent signed consent. If that 30 days ended up moving over into the period after schools are closed, then the state has been very clear, is that it's not legal for districts to say that they're going to have a blanket policy that they will not conduct any initial evaluations or any reevaluations during this period of school closure. The state's been very clear that the district has to do as many parts of the assessment as they can safely while schools are closed. So as Anne was talking about, if there's parts of the assessment that require an interview with the parent, or that there's some inventories that the parent or teachers fill out, then the school district's expected to move forward with any kinds of assessments or parts of assessments that can be done validly and safely. In addition, there are some, as we know now, schools are in the gradual process of reopening for summer services for kids without disabilities and with disabilities in certain circumstances, as we talked about last week. So there are certainly some school districts who are going to be taking advantage of that as they get the PPP and other things in place to start conducting assessments over the summer. So what the state has said is, because of the safety concerns, the district can't meet the timelines that are always in effect, 30 days after the parent gives consent, then they have to contact you as the parent, see if you're willing to agree to the delay, see if you can together work out a time and a way to conduct the testing as soon as possible, because as Anne was talking about, for initial evals, they're waiting to get services. If you as a parent don't agree with what the district's proposing, then you have the right to file a complaint with the state, to go through mediation, and we can, David or Lilia will be sending out information from our past slides that have information about how you can go through those processes. We have found that if parents reach out and advocate within the school district level, sometimes they can work these things out, especially as the state's been very clear that districts should be doing everything they can. And I think Anne's, given a lot of examples of how school districts can move forward now, particularly as they can gradually reopen in a way that's safe, or through learning how to do the teletherapy pieces, as validly as possible. Anne, do you have anything to add?
No, I think, one of the things I'm wondering is if schools will be more accepting of independent evaluations, because it's so hard to evaluate kids now, so that if a child comes in with a reasonable evaluation, a lot of times if you do an independent evaluation, schools will say that's great, but we want to do our own testing. I wonder if there might be more pressure on them to just accept an independent evaluation.
I think it's different with different school districts. Some school districts are saying that they're more likely to look at it for a reevaluation, but some of them are not being as open to outside of testing, whether as we think they need to be during this pandemic and as there's a legal argument that they should be. So who knows? A lot of this is going to be, well, we'll see over time how things work out. I think that school districts are we know there are so many children who are backlogged, waiting for their initial vals to be completed, waiting for reevaluations. And for some kids, the reevaluations are really important because it's not just monitoring their progress, but there's a new suspected disability or some other unmet needs that really require the same kind of level of evaluation as an initial evaluation. And I think parents are worried about how long it's going to take districts to catch up with all the many, many kids who are waiting. So I think all these options need to be explored outside evaluation and also really advocating for more vals, effectively by the school district.
Right, and I think figuring out ways for independent evaluators and school districts to work in concert.
Absolutely.
Not have this look like an adversarial situation, but, to get together on what needs to be done, how are we going to do it, kind of make a plan, because there's just not going to be enough man and woman power in the schools, I think, to carry these evaluations out.
That's a really, really good point. And the other thing for the children who are newly potentially entering special ed is the state has said very clearly, if only parts of the assessments can be conducted, and if there's other information in addition to the testing, the way Ann is talking about, that there always will be for initial evaluations, then schools can they can determine eligibility, they can write a partial IEP so that services can start. And then as things reopen, they can finish the testing and then reconvene the team to consider additional services. The goal is to move things as quickly as possible for kids. So that's another option for the family with that question.
Yeah, awesome. And a quick follow-up on that. So if the parent did want to go to a private evaluation, are you aware of any options that parent may have?
Can you repeat the question? And after this question, we will do the poll, so people need to leave. I just realized we've already reached our 45-minute mark, but can you repeat the question, David?
Yeah. So this was a follow-up to the first question I asked. So the parent asked, if we go to private evaluation, what are our options?
I'm not sure I understand the question, but if the family is looking for where to go for a private evaluations, then they could call our helpline. There are offices like NESCA. There are some evaluators take insurance, some take Mass Health, some do, some don't. So we can give that parent more information. They may be looking for evaluators who are conducting the type of assessments that Ann Helmus is talking about. Ann, do you understand the question better than me? I'm guessing what the person wanted.
Yeah, I interpreted it the same way that you did. I think, the hospitals are all back in business doing testing, primarily the teletherapy type testing.
And again, if we aren't answering these questions well, please email or call our helpline. I do know some people need to leave. These are, people are so busy in these unprecedented times. So I'm going to thank Ann, who has also agreed to stay until 9. I know we have a lot more questions, but anybody who needs to leave, you can feel free to leave. Thank you so much for joining us. We will be here again next week, and thanks so much to Ann for spending her Thursday evening providing us such important and really clear information. We really appreciate it. And we do have 10 more minutes for those more questions. And Joanne, you're going to show the polls, right?
Yeah, it's not letting me, Julia, so I may not be able to.
We'll just keep going.
I'll keep trying.
Awesome. Well, in the meantime, let me go ahead and we have a really great pool of questions. Our next one is, can districts make a blanket statement that all ESY programs will be remote?
No, that the state has been repeatedly very clear about it. Extended school year, the summer programs that are in some children's IEPs, the state has said that those kinds of blanket statements are not consistent with their guidance about what's required under federal and state law. The state has issued very specific guidance about different things that each district needs to do so that they can provide in-person services to as many high-need kids as possible. over the summer. Things like ordering the PPE and cleaning and disinfecting and figuring out safe transportation. So every district has to start doing those things as quickly as possible. And as things get in place safely, then whether it's July 6th or August 6th, they are supposed to be starting to provide as many in-person services as possible to as many high-need kids as possible. But the blanket statements are not consistent with the law.
Awesome. Thank you for that. Our next question up, can a WAIS be done over the computer for a 21-year-old in anticipation for DDS approval?
So the WAIS is an IQ test for people over the age of 16, and it could be done. Some of the subtests would be difficult to do because they require props like blocks, and so you'd have to work out how to send those to the person, but it definitely could be done.
Okay, awesome.
And I don't know whether DDS is going to accept those results. Right, I think that's the problem, is that you may do this and then the agency may say, well, it was done by the computer, so we're not going to accept it.
Right. And while I have you, there's another question off of your presentation. Do you think districts could implement the 2-office model effectively? Yeah,
I don't understand why they wouldn't do it, because it's the low-tech answer. It costs less than $5,000 to have that installed and buy the headphones, and many schools probably already have a setup where they have 2 offices where there's observation room, or even up in our New Hampshire office, we didn't even bother to install the plexiglass because there was a situation where there was a large pane of glass next to a door, and it was perfect, and we just put the 2 tables up, one person in the hallway, one person in the testing room, and it's worked out great. So I think there's probably a lot of physical spaces in schools, especially this summer, where they probably wouldn't even have to do any construction. All they have to do is buy the headphones.
Awesome. So we have one parent who's concerned about their middle school child doing a 3-year school evaluation, and mainly worried about certain things that may happen in in-person school versus remote schooling. And so mainly looking at advice. So should this parent wait for school to return to in-person, or do the 3-year evaluation now and then request a follow-up later?
I think it's a hard question to answer without knowing all of the details, of how old the child is, what the area of disability is, what they're trying to find out from the evaluation, how the child is doing. And that's what I think, with the testing that's being done now, I think they're just going to have to be a lot more sort of planning and thinking through things than was the case previously. And that's where I think, if some partnerships can happen between schools and independent evaluators, where everybody can think through, what are we trying to find out from this evaluation? What do we agree will be an appropriate way to get the information given the constraints of the current situation? I think those are going to be much more fruitful kinds of situations, and to explain, what we can and can't do.
Awesome. Now, I do want to remind all our participants, I know Julia said this earlier, but our helpline is open if you do want to discuss your case more in detail. So another question I have for you, Anne. So what about reevaluations if there's like a new suspected disability type for a child, or perhaps a new area of delay or need? Could tele-assessments be helpful in that instance and make sense?
Potentially. I think it depends on what the new area of need would be. And I think one of the new areas of need that we're going to see a lot of over the next couple of months, just get rid of this poll, is going to be emotional issues that are going to be caused by the sort of chronic stress of the situation the kids and parents have been in over the last 3 months. That's going to then continue over this summer. And we do have a lot of good questionnaires that can be used. A lot of times doing an evaluation of a child's emotional functioning requires a good taking of history, of good interviewing of parents or other people that are working with the child. There are some questionnaires, depending on how old the child is, the child could fill out. I could see for a younger child that you could perhaps do drawings with the child via teletherapy. So yeah, I think that it depends on what the area of disability is that you're trying to figure out. But I think the most common area of new disability that we see in kids whether it's COVID era or not COVID era, is emotional consequences of whatever they're dealing with. And I think those things could be evaluated by teletherapy.
Awesome. Thank you for that. So we have another parent who has a child in an ESY in an out-of-district setting. But unfortunately this year, the out-of-district program may not be opening for ESY this summer. If the parent accepts and participates in the school district program, will they lose their stay put for the ESY program?
To defer to Julia on that one.
If I understand the question, it's that the child is an out-of-district day program, I assume. And I would, this might be a good thing where the parent may want to contact the helpline, because the out-of-district schools as well as public schools need to be providing the IEP services, which includes the ESY services, at a minimum remotely. Everybody, all districts and all out-of-district placements need to be providing remote services. So I don't know the facts to know why the out-of-district program wouldn't be providing the summer services. And then I hate to be lawyerly about this, but really it's going to depend how the school district's ultimately responsible for implementing the IEP. So it depends how the IEP is written, whether or not that would impact stay put or not. Arguably it wouldn't, but it's really hard to give a clear answer without knowing exactly how the IEP is written.
Awesome. Thank you. Let me see what else we got. Okay, perfect. So super blankets are being issued in many disagreements. They're using PPE or lack thereof as inclusion. Should those be signed up for an IEP for this? And what does high needs mean specifically?
When David sends out the information from our talk last week, there will be a lot of specific information about how school districts are supposed to determine who's high need or high priority. It's based on the level of the number of services, the level of services, the complexity of the child's disability, how they've been doing over these past months. But many districts don't have the protective equipment in place now. So if they don't have the protective equipment in place, they cannot start providing in-person services on July 6th. But every district is supposed to be doing everything they can to get the protective equipment in. And when they have enough in to start serving a small number of kids safely, then they're obligated to start doing that. So that's why the blanket statements are not, it's like everything was in the months before. School districts can't start letting kids in school when it can't be done safely, but it's anticipated that over these coming weeks, their capacity to provide at least some in school or in-home services safely should be increasing over time. Again, you can call, it depends on the specifics, but it's expected. And when we have seen many school districts who started with the blanket policy of no summer in-person services, shifting their policy over the last week or so, consistent with state guidance. So that's hopeful.
Awesome. And then another question, I think we may be winding down to the end here.
Yeah, this looks like the last question.
So should parents get MCAS, get info from 2019 this spring, or is it ineligible because of school closure?
Sorry, can you repeat that?
Yeah. Should parents get MCAS, get info from
MCAS,
2019?
MCAS.
Oh, MCAS, I'm so sorry. MCAS get info from 2019 or spring, or would that be considered ineligible because of school closure?
I'm not sure I understand the question, but like Ann was saying, all other information, in addition to the formal testing, MCAS results are very relevant in terms of looking at how a child's disability is impacting their progress. So 2019 scores could be relevant in terms of a 3-year reevaluation. But I'm not sure I understood the question beyond that.
Okay. And I definitely will throw it out again as the theme for the night. Our helpline is definitely open, and again, you can visit our website for more information.
So again, email or contact our helpline. Thank all of you who have been so zealously pursuing the kinds of avenues to get services for your children, even in these most stressful, unprecedented times, and staying up what is past many of our bedtimes. And thank you so much to Ann Helmus for spending her time tonight, and really for everything you and NESCA do to help kids get the services that are so vital to their development. We really appreciate it.
It's our pleasure. Thank you all for your attention tonight.
Thank you, Ann.
Thank you.
Bye-bye.
So,
All right, I'm going to sign this off, David. Oh, yeah. Oh, wait a minute. I want to do something.
All right.
Thank you so much.
Yeah, thank you for your help.
I don't know what I'm doing. I don't know what half the stuff is on here. I'm going to shut this down. Thank you, everybody. Have a good night.
Thank you, everyone.
Oh, I'm going to end the recording.